Stair negotiation is one of the most commonly problematic tasks for individuals with knee pathology. Going up or down the stairs generally consists of 3 phases. First, the patient shifts his weight to the support limb to allow placement of the leading limb onto the next higher step. Next, the patient transfers his weight to the leading limb. Finally, he raises his body weight up to the next step, bringing the trail limb along. These phases are generally the same whether the patient is using a reciprocal or a non-reciprocal pattern to negotiate the stairs. Patients who have difficulty ascending stairs can be taught to use their plantar flexors on the trailing limb to help raise their body weight up to the next step. Patients with pain or quadriceps weakness limiting their ability to raise their body weight up to the next higher step may also be taught to add a vaulting technique. The vaulting technique helps to reduce the demand for the quadriceps in raising the body weight. In this technique, the patient contracts the gastrocnemius muscles of the limb on the lower step to raise the body weight up to the higher step. Simultaneously, the hip extensors of the limb on the higher step also contract to assist in raising the body by extending that hip. This combined use of the gastrocnemius contraction on the lower limb and the hip extension contraction on the upper limb creates a vaulting action to help raise the body weight up to the next step. To reduce knee pain when descending stairs, a patient may point his or her toes downward and make initial contact with a plantar flexed foot to help absorb load and reduce flexion in the trailing knee, allowing the gastrocnemius muscle to help absorb that force. Alternately, knee flexion moments may be reduced by having the patient turn at a 45-degree angle relative to the front of a step while descending. This technique is useful with both reciprocal and non-reciprocal patterns. A final option not shown in this video is to teach the patient to descend stairs backwards. While this may not be feasible for patients with significant balance deficits, it may be temporarily useful for those with severe pain or quadriceps weakness when attempting to descend stairs using other methods. As soon as the patient's symptoms become less acute, it is best to transition back to a forward or a 45-degree pattern.